My name is Gabriel Linden, and today I will be presenting on behalf of Boston Children's Hospital our findings regarding initial adherence to brace wear, predicting future brace wear, and adolescent idiopathic scoliosis. A quick background into this topic: bracing for mild to moderate scoliosis has evolved greatly over time, and technological advancements have allowed for the objective measuring of patient brace wear through thermal or pressure sensors, in which recent studies have elucidated that adherence to prescribed brace wear is a crucial factor in brace outcomes. Bracing patients at our institution undergo an initial 1-month wean-in period in which they gradually increase their brace wear until a point known as stage 3, in which they should be wearing the brace close to the full amount. And you can calculate a patient's adherence ratio at this point by using the embedded thermosensor within the brace. So we were curious, what if we separate patients into two groups, an adherent group and a non-adherent group, based on their adherence at stage 3, and we see if this initial adherence or behavior might predict their future brace wear. We identified 83 candidates for our study that were braced during a certain period, were a certain age at their first brace fit, and did have the embedded temperature sensor to assess brace wear. And from there, we excluded 20 of these patients for a final cohort of 63 that were mostly female with thoracic curves. Our results demonstrate that at the initial stage 3 wean-in period, not only did the groups wear their brace different amounts then, but these trends continued on at the follow-up appointments, where the adherent group was wearing their brace more leading up to the 6-month follow-up appointment and leading up to the 12-month follow-up appointment, to a point where it actually affected their Cobb angle change to a statistically significant level. It's also interesting to visualize our results via a spaghetti plot where each line represents an individual patient's adherence over time. You can see in general, patients who were above that 80% threshold tended to stay above that threshold. And you can represent this as well as an odds ratio, where patients who were initially adherent at stage 3 were 11.4 times more likely to be adherent at the 6-month appointment, 5.6 times more likely to be adherent at the 12-month appointment, and if they were adherent at the 6-month appointment, they were 27.5 times more likely to be adherent at the 12-month appointment. Thus, our findings suggest that the wean-in period brace wear adherence may predict the future brace wear of a patient, and that at this point, if the patient is below the threshold of adherence, supportive interventions or alternative treatments should be considered to prevent progression to surgery. Here's our contact information and references, and thank you to SOSORT for allowing us to present our findings on brace wear adherence for AIS patients. Thank you.